Your healthcare professional will set up a feeding plan for your child. This plan will include the formula to use, how much to feed your child, and a schedule for feeding. In addition to formula, you'll need a feeding container. If the container does not have an attached feeding set, you'll need tubing to connect the feeding container to your child's feeding tube. Ask your child's healthcare professional how often you should replace the feeding set and container, and how you should care for them in between feedings. Always wash your hands to prevent contamination before preparing the formula and before touching the feeding tube, tube site, or feeding equipment. Wash with soap and water. Rinse thoroughly. Dry with a clean towel. Let's look at how you prepare the feeding.
What I usually do is I get his formula prepared, and then I put in about 8 ounces of water, and then I add 7 scoops of formula to the water, and then I put the lid on and shake it.
Measure the amount of formula for the feeding in a clear measuring cup. Write the date and time on the feeding container. Attach the feeding set to the container, if it is not pre-attached, and close the clamp. Pour the formula into the feeding container. Hang the container on an IV pole or wall hook. Cover any unused formula and write the date and time on it. Store it in the refrigerator. Follow the instructions for gravity feeding or pump feeding. Your child's healthcare professional will tell you which method to use. Make sure your child's feeding tube is in the right place. Generally, correct tube placement must be confirmed before each intermittent feeding. When feeding continuously, placement should be confirmed every 4 to 6 hours, or as directed by your child's healthcare professional. There are several ways to confirm tube placement. Because no one method is foolproof, always use 2 methods each time. We will discuss the 2 most common methods of placement confirmation used by patients at home. It is important to follow any specific instructions provided to you by your child's healthcare professional. You can confirm placement of a gastric tube by checking the fluids drawn out of the stomach. Begin by connecting a clean 30 milliliter syringe to your child's feeding tube. Slowly pull the plunger back until you've withdrawn a small amount of fluid from the stomach. As a visual check, the fluid should look like formula or be mostly clear to slightly yellow. This indicates that the fluid is probably stomach contents and that the tube is in place. To confirm placement of standard G tube and J tubes, measure the distance from the skin to the end of the tube. When the tube is first placed, record this distance and refer to it every time you check tube placement. Always compare the measurement you take with the number recorded after the tube was first placed. If there's a difference in this measurement, you should contact your child's healthcare professional before giving the feeding. Whichever method you use to confirm tube placement, if the feeding tube is not in the right place, do not feed. Call your child's healthcare professional right away. Ask your child's healthcare professional how to confirm placement of low-profile tubes. Do not use the tube and do not feed if it looks like the tube has come partway out. Call your child's healthcare professional for instructions on how to proceed. It is important to properly position your child while they are receiving their tube feeding. Proper positioning will help reduce your child's risk of breathing or aspirating formula into the lungs, which can cause serious problems. An older child can sit in a chair or high chair, or be propped up on a couch in a half-sitting position, at least a 30-degree angle. If you feed your child in bed, place rolled blankets under the mattress to raise the head of the bed 6 to 8 inches, 30 to 45 degrees. Lay your child on his or her right side. Stop feeding if your child cries. Start again when your child is quiet and calm. Keep your child in a raised position for at least 1 hour after the feeding. Lying flat may cause coughing and/or vomiting. What not to do? Do not give a feeding while your child is lying flat. With an infant, try holding your young child as if you were providing a bottle. Your child's healthcare professional should evaluate your child regularly And track your child's weight and height to make sure he or she is getting the right kind and the right amount of formula for growth and development. You should keep track of the amount fed, as well as medications and any extra water you give your child. Record this information in a notebook to share with your child's healthcare professional.